A potential breakthrough today in negotiations to add more money to the Small Business Paycheck Protection Program.
I think we're on a very good path. First of all, I support the CARES Act. We were very pleased to be able to turn it from a corporate trickle-down bill to a workers' first bubble up, and support the PPP, the Paycheck Protection Program, in there. And so as they have committed the money that is there, we want to add more.
I think we're making a lot of progress. I've had multiple conversations all weekend with the leadership of both the Senate and the House. I spoke with Chuck Schumer this morning already. I know he's on after. And I think we're making a lot of progress.
NBC News reports that most of the $350 billion allotted for the initial program was spoken for almost immediately, and that only small business owners who happened to get their application in at the earliest possible moment were likely to get funded. Let's welcome Congresswoman Debbie Marcarcel-Powell. Debbie, it's great to see you. I'd love to get your reaction to this latest news that we might be close to a new deal.
Hi, Alicia. First, let me just say I want to extend my gratitude and thanks to all those healthcare professionals, farmers, essential workers that are really putting their life on the line to give us what we need during this pandemic. So I just wanted to take that moment. Yeah, we have been working relentlessly in the past week to reach an agreement, a bipartisan agreement, to provide additional funding through this emergency aid relief package. Now, what happened is we had passed in the CARES Act $350 billion for small businesses, which included that Paycheck Protection Program. Those funds ran out fairly quickly because it went mostly to those businesses that have long-term relationships with their financial institutions. I've been hearing from women-owned businesses, minority-owned businesses, farmers, fishermen. They were not able to access those funds. That's why all this past week we've been in negotiations, and I'm pleased to say that I think that we are going to reach a bipartisan agreement that will include additional funds not only for small minority-owned businesses and veteran-owned businesses, but also to hospitals. Hospitals are really facing dire straits. Yes.
Well, in addition to what you're talking about the relationship between some companies and the banking institutions, there's also reporting from Stephanie Ruhle that the rules for qualifying for the loans were so loose that the program was opened up to many businesses and people who weren't the intended recipients, including wealthy folks who were able to form LLCs. How do you then write these provisions to make sure that the money is actually getting into the hands of the people it is intended for?
So one of the things that we are asking for is that a large portion of this funding goes directly to community development banks in these areas so that they can actually provide those funds to those minority-owned businesses and veteran-owned businesses, also to credit unions. You know, when you hear, we got approached by the Senate that they needed an additional $250 billion check. They wanted us to just send an additional $250 billion, and it would have gotten us to the same place where we are now. Those funds would have run out very quickly. So we have been advocated for those very small mom and pop shops that we have, especially here in South Florida, so that they can access those funds rapidly.
I do have to ask you, new footage of people on beaches in Jacksonville, Florida emerging. I'm sure you have seen that footage. What is your reaction to the governor choosing to reopen your state?
Alicia, it's reckless, it's premature, it's irresponsible, it's putting Floridians' lives at stake. We've seen this virus knows no borders. I don't understand what this governor is thinking. He's already been ranked 50th in how he's handled the pandemic, and he continues to make these decisions that are putting our lives at risk. Before we can have a plan to reopen beaches or our economy, we need to have a science-based approach, which we've been working on in Congress. We need to ensure that we are past the peak, that we have enough equipment for our hospital workers, that we can have a rate of infection that's below 1. We're not near that yet here in Florida. In Miami-Dade County, we have over 9,000 cases. We've approached now close to 200 deaths. What he's doing is putting our lives at risk here in Florida.
Congresswoman Marcarcel-Powell, thank you so much for your time.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.